friend. Yeah, I do believe we hear the very consistent and similar finding from EBC man and the DK quality 5. So I don't think Asian group is a competitor of EBC, European Bifurcation Club. We have to put together of our individual data and to provide a very comprehensive conclusion with our community. Thank you.
Yeah. Yeah, definitely. The study was negative because the hypothesis of the study was to present benefit of superiority of single stenting, and this was not done. There was by numerical analysis shown there was we have less events if we compare single to double, less events in the single stent group, but this study is definitely negative. And to make large conclusions, as you mentioned, you're right, it's difficult. But however, it gives information that according to crossover only of 22%, it means a vast majority of patients with, I would suggest, quite simple distal left limb bifurcation can be managed by a provisional approach. But there is, in Europe, as you saw, even high volume centers, they are not really pushing Dickey crush. So we were one of the centers with a few Dickey crush patients, if patients were randomized to double stenting. So we went primarily with Dickey crush.
Yeah, may I add a comment, please?
Yes, Sivan. Okay, you can.
Yeah, actually, if you look on patient included in EBC trial, I think there are the ideal patient to single stenting because short lesions and 22, let's say, a syntax score that means no disease on side branch, just proximal. And I think these are the ideal for single stenting. And despite this, 20, which is not small number, 20% is shifting to 2 stents. And 20% also having the outcome is impacted by was mandatory to have kissing balloon inflation, right?
Right.
22% did kissing balloon inflation after provisional stenting, and 22% shifted to 2 stents. That means you might have more and more patients shifted because of kissing balloon after provisional stenting. Is that right? Have you looked on these data?
And we will check this data for long side branch lesion and bifurcation angle and calcified, non-calcified. So all this analysis will follow next year. So this is on the way to be prepared, this analysis.
Yeah, but it is amazing because it's 22% where have kissing balloon was done after. That means 80% they did not do kissing balloon inflation and was mandatory by protocol.
That's correct. At least I can speak for my center.
Yeah.
We have done
so and only 22, and from these 22, maybe many shifted to 2 stents after kissing balloon.
That's correct.
Yeah,
that's correct.
Okay, I appreciate Dr. Shaoliang Tan's comment, and I understand his gesture. Actually, you know, in EBC main trial, you must rightly say 22% patient need second stent, actually, you know, and but they, by their protocol, they preferred culotte and tap, but only 5% case they are doing DK crush technique. So how can you interpret which one is much more perfect for these procedures?
As I mentioned, Dickey crush is in Europe less popular compared to Asia. And there are centers they use it like I like it. If I have complex anatomy, I go first with Tiki Crush, as you saw in this young patients after unsuccessful surgery. So it was for me clear this is we have good data for this kind of patients, and it was for me the safest way to manage this case. I think in many cases, in many cath labs, people are skeptic. According Dicky Crush is taking more time. It's consuming more balloons, wires, whatever. And yeah, I think we have to do something more to teach younger doctors in Europe, according
Thank
to
you, Farang.
perfect
And
approach of
today we had a wonderful live case from Italy. Nowadays we are seeing DK crush is becoming popular day by day in Europe also, especially in the Italy. And Dr. Shaoliang Chan, can you make comment why it is not too much popular regarding we have enough strong data right now, whatever the small number, but we have strong, very large, good study. Why it is not too much popular in, especially in the Europe?
Yeah, I think this is a very important a point. A, I don't know why, but I think we still need to do more clinical trial to convince European friends. But the exception is that some European centers are very experienced in using DK quality, like Professor Shaban. Secondly, I think, particularly recent years, I have very strong feeling that some Europe guys refused to trust some data from a Asian community. So I think if so far we have DCAT Quality 5 and the EBC main trial. So if we design one more additional trial to compare two stent and the provisional for simple bifurcal lesion, it's no meaning. It's a waste of investment. So I think, to be honest, I think there's not necessary to design one more study to treat the simple bifurcal lesion. As Imad said, from our definition one trial, we can compare the one stent, two stent for simple bifurcal lesion. So the final provisional is the winner. So I think this is the final conclusion. The next step, I think we have to cooperate each other between Europe and Asia to find more solutions for complex bifurcal lesion. That's all. Or even we can find the similarity between a bifurcal stenting and a cabbage. That will be the best way. Thank you.
Thank
Mm.
you. Now I introduce our Bangladesh, our Secretary General, Professor Mir Jamaluddin. All of you know he is the Director of National Institute of Cardiovascular Disease. And after his talk, our President, Professor Akam Fazlur Rahman, will give a small comments. Before going to them, I just announce, I just give a one single small announce. Our Noor Alam will conduct a very interesting quiz session after this session. Very interesting quiz session. Everyone can participate. Just click the link, answer 3 questions. I hope you will get the first prize or second prize or third prize, whatever your performance. Second thing, and today we had a wonderful live case from Italy. Antonio Colombo also there, and there is a Gabriela and also Reimer also there. They performed the wonderful case, and especially they did it. It is ended up by DK crush technique. So that's why I'm telling you that is nowadays it has become popular. Anyway, sir, Professor Mir Jamaluddin, sir, can you
Thank
tell us?
you. Thank you, Professor. Thank you, Professor David Taggart, Professor Imad Shivan, Dr. Mirslo, and Professor Dr. Shao for your brilliant speeches in their perspective. At the end of the day, if we want to say in one sentence, what is our conclusion? According to EBC main, you have told that professional approach should remain the philosophy of choice to the majority of left main stem through bifurcation procedures. And according to Chinese, this is most likely a bit of biasness that is also in relation with Chinese and in relation with Europeans. Everyone always wants to do PCI or angioplasty simply. Make it simple. It is the basic rule. Whether in Europe, whether in China, everywhere we try to do it simply. But if we require complex lesion, if there is complex lesion, if we have to require upfront double stent strategy, in that case, there is the only difference between European and Chinese so far I have understood. The Europeans mostly like the single stent strategy with, if necessary, tap or culotte, something else. But in Chinese, these studies, the DK class 5, DK class 6, they have clearly shown the superiority of it and they prefer it. In our country, we also prefer the simple one, whatever it is. If the mostly we want single stent strategy, if possible, approximately 50, 60, 70% cases of the distal left main. But if upfront two stent strategy is necessary, then according to anatomy, according to different criteria, according to angle of the lesion, angle of the vessels, according to the dia of the vessels, according to the length of lesion in the side branch, considering all beyond this, considering the calcification, whether there is significant calcification or not, considering all this, if we decide to stent strategy, then we consider that DK crash is one of the best technique ever seen and we are also doing. But in professional stent strategy, we prefer tap or culotte or something else. So at the end of the day, our slogan is to do simple, is to remain simple and to give the best outcome to the patient. Thank you. Thank you all the learned speakers as well as our learned participants and faculties. Thank you. Now our professor, now our president, Professor Dr. A.K.M. Fazlur Rahman. He is the chairman of Department of Cardiology of Bangabandhu Sheikh Mujib Medical University and president of this Bangladesh Society of Cardiovascular Intervention. Now he will wrap up the program. Thank you.
Thank you very much, Professor Mir Jamaluddin. Actually, from my society, Bangladesh Society of Cardiovascular Intervention, we are very much grateful to Professor David Target, Professor Imad Shaban, and Professor Farnak and Shaolong. You are a long time, we give a valuable time to give a valuable lecture in the conference of my society. Actually, you know, the Bangladesh is a developing country. We are facing so many problems in the field of intervention. I hope with your very, very great leadership, we will be in the proper position in future. So this is a very important session and there is debate is going on in whole of the world. Whether we will put one stand, whether we will put two stand, whether it will be DK crash, whether it will be mini crash. It is a ongoing process in the whole of the world, including my country. If I tell you very simply, it is whatever may be the procedure, or whatever may be, it depends on the anatomy of the lesion. It depends on the underlying pathology of the lesion. It depends on the experience of the operator and his choice. So it will be differ from one operator to another operator. Somebody tell me DK crash may be good. Somebody may be called culotte good. It is 100% depends on the operator's choice and experience. So with this, I thank again you. Inshallah, after control of the COVID, we will meet with each other in the next year conference. Thank you very much.